Hello. I'm finding out that the only time I have to do updates is right out of the shower, so that's what it is. I'm just gonna keep going until I get everything out. So I'm gonna do my makeup while I talk to you because I've got some more training I gotta do. And this morning was rough getting up. I'm just wanting to report what I'm going through. Really hard to get up, and that's usual, but right now, once I get going and I get some coffee in me, if it wasn't for coffee, I wouldn't be a dependable employee. Excuse me. What was I gonna say? Okay, so I wanted to touch on a subject. For me, it is, when I researched Lymes patients, that when I first found out about Lyme's disease and I started researching people that had late-term Lymes, and I was getting the diagnosis for it, I ran into some individuals that had questionable practices for treatment, and I wanted to say something to defend them. With this illness, you've got nowhere to go. So if you're like me, where you're fighting tooth and nail for some answers, you'll do pretty much anything. And I don't care if you think that you're scientifically minded or you believe in the common practice of treatment. If you were put in our position, you too would be investing your time and belief into anything that would give you relief. So, unfortunately, this illness takes you to the most extreme cases or most extreme points of life. You have to battle society's understanding of how things work, which is you go to a doctor, you get tests ran, you get some kind of recognition of what's happening to your body, and granted there are some illnesses out there that, don't have any kind of a full recovery that you just have to live with, like AIDS or, cancer can kill you, but it's recognized and they can find it. And with ours, the political debate is that it doesn't even exist. So you're pretty much taking your body. I have more respect for my body now than I ever could have imagined. I mean, your body can go beyond places you could even fathom as far as pain it goes, or illness, and bounce back from it. And so it's incredible. But you will go at all lengths to get relief, because you have to continue. You have to keep waking up into this, and you have to do that in pain most of the time, or losing your abilities, without answers, without recognition. So, people are going to lose a little bit of their scruples along the path. I'm sorry, I don't want to offend anyone, but, and I hope, I probably look that way too. I mean, I've been to hell and back, literally. And I've had to fight tooth and nail to survive, against all odds. And how do you function normally after that? Or during this, I should say. I'm not after it yet, but I plan on getting there. But you've just experienced something that people can't even wrap their heads around. So there's going to be a little bit of questionable action. And I want to defend those people, because those people are warriors beyond your wildest imagination. They have been through it all. And against people that are telling them that this doesn't exist. Snap out of it. You don't think that any one of us doesn't want to just snap out of this, or that it doesn't exist, or that, heaven forbid, if it was psychological, I would go into treatment tomorrow with a, what do you call them, a psychiatric or a psychiatrist if that's what the answer was, but I have a disease that's killing me on a daily basis. And so that's what the problem is. And that's what the problem is for all the people out there struggling with this. So the other point I wanted to make was about doctors, and then what I've learned about people during this that gives me faith in human beings. So you have your regular doctors that are backed by insurance, that are working out of hospitals. Now, some of them that were rude to me or just kind of tossed me around like I didn't matter, maybe they read up on Lymes and they read the controversial or political problems and they believe that it doesn't exist, or they believe the requirements for the treatment. And, I can't blame them. So they're going to give you that kind of an attitude. And then there are the ones that know what's really going on, that know the science behind it, that know that what it does to the body. And heaven forbid they want to help you, but their hands are tied. And the reason why their hands are tied is because they have to go by the treatment requirements for this, which doesn't do anything. I don't care what people say. It doesn't do anything, what the requirements are as of to date. So if a doctor that wants to help you goes outside of those requirements, they're now subjected to their license being pulled from them. Let's say they treat someone like me and I die because I was on antibiotic. I die from the disease. Let's say I die from the disease. But they treated me outside of the protocol and gave me more antibiotics or did something that they thought was actually going to help. And my family gets upset and decides to sue them. They could lose their medical license. And that would actually make it impossible for them to help people that they actually have answers for. So, I understand I got the shitty end of the stick, or I pulled the wrong straw out of the bunch. But this is the part where I have faith, and that is there's a whole underground society or doctors, people that are incredible, that have put their lives, their livelihoods out on the line to help people like us or me. And when I was talking about Lymes literate doctors, they usually treat outside of the requirements or out of the not suggested, it's pretty much backed by law now, standards that the CDC, or not the CDC, the Lymes Society, not Lyme Society, the insurance, this is the crazy part, the insurance companies have their hands in this mess. And so they're helping to, as far as I know, this is all coming from me, this isn't, things that I've read, but they have their hands in the protocol. So these doctors go against what the standard is, put their medical licenses out there at risk to treat people like me. And they're going against what normal doctors have, which is, backed research off of, for treatment. They have to kind of just go by the people that they've treated and what's worked and what hasn't worked, and just keep trying, and I'm sure that they've lost lives during the findings of what works and what doesn't work, and I'm sure they've had people that have called them names, or there's probably a lot of disheartening things that have happened, but God, thank you so much for giving it a try, for giving us something. And the worst part is that when I have to explain my disease to someone, and then I have to explain treatment, and then I have to explain that I have to go outside of normal doctors to get treatment, that makes me sound like I've completely lost my marbles. And at this point with this illness, I don't care what I sound like. I don't care what the norm is out there or what is socially acceptable. All I care about is getting better and having a shot at life beyond pain. And right now, you know, I have to go. God, I can't stop coughing or getting a frog in my throat. I have to go against everything. I have to go against insurance. I have to go against common belief. I have to go against a disease that doesn't have answers, that doesn't really have a treatment protocol out yet that they really know of. I have to go against even the existence of this. And yeah, that's gonna make you look a certain way. I had a friend that was studying to be a lawyer, and I thought this was a really good point. And this is a different discussion that we had, but it kind of pertains to this situation. He's studying to be a lawyer, and I told him, be careful. You know, you are going to be in the field of defending people's rights. So know your client. Know the individual, if they're being honest or not, what their history is, what happened, inside and out. Because anybody can be made to look any way. And that's the disheartening part about this whole thing is whoever's out there, and I think it has to do with the insurance. I believe, so you can't do anything to me about saying I believe in something, but I honestly believe that the insurance companies, this is a free-for-all, man. This is their dream for denying the existence of an illness. There are hundreds of thousands of people out there that are dealing with this, and so desperate that they will do anything and look like anything to get some sort of an answer. And so that's just backing them even more in their little monetary excuses as to why this doesn't exist. Oh God, how would I say this? It's so difficult. Yeah, so it's basically, in my mind, it all results to money. And the other thing I wanted to bring up is, I forgot who said this, but sometimes you serve as a warning to others, and with this illness, this is a huge warning to society. Huge. You better be scared. Because I think what's going on is insurance companies and, you know, companies that have investments, drug companies that have investments in this illness or don't want it exposed, know that if there was a test out there that could test you positive 100% and it was recognized and doctors could use it, that it would be a landslide of reports, a landslide. And what would that do to their profits? That's what I believe is going on here. And so I'm here to fight for my life, but also to serve as a warning to all of you out there that are healthy individuals that are paying money into insurance companies, that are paying belief into our system. And it's malfunctioning, and I'm living proof of it, and so are all the other warriors of Lymes disease that are out there right now. So yeah, anyways, enough with that. I hope that helps people understand that are at least not in the circumstance, or that are just looking into it, or maybe are dealing with it, of what's going on. And maybe my beliefs are wrong, but you know, I've had 5 years in this. I'm 2 more years away from what my doctorates would be in an illness, specializing in Lyme's disease. So I think I have some pretty good reason to feel the way I do. And you know, yeah. Anyways, have a great day. Thank you for listening if you are. Bye.